Mental health is a critical part of overall well-being. Nurses play a vital role in caring for individuals with mental health conditions. Understanding and managing psychiatric medications is crucial. These medications stabilize moods and improve quality of life. Nurses administer medications, monitor side effects, and educate patients. Their knowledge ensures patient safety and positive outcomes. Depression is a common but serious mood disorder that affects millions of people. It can manifest as persistent sadness, loss of interest, fatigue, and difficulty concentrating. Antidepressant medications are often prescribed to help manage these symptoms. Antidepressants work by influencing the balance of neurotransmitters in the brain, primarily serotonin, norepinephrine, and dopamine. These chemicals play a role in regulating mood, sleep, and motivation. There are several different classes of antidepressants, each with its own mechanism of action and potential side effects. Selective serotonin reuptake. Inhibitors, or SSRIs, are the most commonly prescribed class of antidepressants. They work by increasing serotonin levels in the brain. Common SSRIs include fluoxetine, also known as Prozac, sertraline, also known as Zoloft, and escitalopram, also known as Lexapro. Serotonin norepinephrine reuptake inhibitors, or SNRIs, are another class of antidepressants. They increase both serotonin and norepinephrine levels. Examples include venlafaxine, known as Effexor, and duloxetine, known as Cymbalta. While antidepressants can be highly effective, it's important to be aware of potential side effects. Nurses play a critical role in monitoring for and managing these side effects. Common side effects of SSRIs and SNRIs include nausea, headache, insomnia, and sexual dysfunction. These side effects are usually temporary and tend to subside as the body adjusts to the medication. Tricyclic antidepressants, or TCAs, are an older class of antidepressants that are less commonly prescribed today due to their side effect profile. TCAs can cause dry mouth, constipation, blurred vision, and urinary retention. Monoamine oxidase inhibitors, or MAOIs, are another older class of antidepressants. They require a strict dietary restriction to avoid potentially dangerous interactions with certain foods containing tyramine. These foods include aged cheeses, cured meats, and fermented products. Nurses must educate patients about potential side effects. They also need to emphasize the importance of reporting any unusual symptoms. In some cases, adjusting the dosage or switching to a different medication may be necessary. Antipsychotic medications are used to treat psychosis, a symptom characterized by a loss of touch with reality. Psychosis can manifest as hallucinations, delusions, and disorganized thinking. Schizophrenia and bipolar disorder are two mental health conditions where psychosis can occur. Typical antipsychotics, also known as first-generation antipsychotics, were the first type of antipsychotic medication developed. They work primarily by blocking the neurotransmitter dopamine in the brain. Haloperidol, or Haldol, and chlorpromazine, or Thorazine, are examples of typical antipsychotics. Atypical antipsychotics, also known as second-generation antipsychotics, were developed later and have a broader mechanism of action. They block both dopamine and serotonin receptors in the brain. Examples include risperidone, or Risperdal, olanzapine, or Zyprexa, and quetiapine, or Seroquel. Both typical and atypical antipsychotics can cause side effects, but atypical antipsychotics are generally associated with a lower risk of certain movement disorders, such as tardive dyskinesia. Tardive dyskinesia is a condition that causes involuntary movements, often of the face and tongue. Mood stabilizers treat bipolar disorder, characterized by extreme shifts in mood, energy, and activity levels. Lithium, a naturally occurring salt, is highly effective in treating both mania and depression. It requires careful monitoring of blood levels. Anticonvulsants, originally for seizures, are also effective mood stabilizers. Common ones include valproic acid, lamotrigine, and carbamazepine. Nurses educate patients on medication adherence and monitoring. They provide support to patients and families. Anxiety disorders affect millions, manifesting as excessive worry, fear, and physical symptoms. Anxiolytics help manage anxiety symptoms. Benzodiazepines enhance GABA's calming effect. Common benzodiazepines include Xanax, Ativan, and Valium. Non-benzodiazepines like Buspar offer lower dependence risk. It is crucial to remember that this is just a brief overview of a complex topic. Always consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment.